A new primary care model is making news across the country by offering personalized medicine like the concierge healthcare that has become more common in recent years, but this time it's at a much more affordable price. You're listening to ReachMD Radio, a channel for medical professionals. I'm Bruce Japsen, your host, and joining me today is Dr. Tom Lee. Dr. Lee is founder of One Medical Group, a San Francisco-based company looking to set a nationwide example when it comes to primary medical care. Dr. Lee is an internist and a business executive whose past ventures included being part of a founding team of the company Hippocrates, which worked to provide doctors and other health professionals with up-to-date drug dosing and interaction information. We're so happy to have him join us from his offices in San Francisco. Dr. Tom Lee, welcome to ReachMD Radio, the channel for medical professionals.
Thanks, Bruce. Nice to talk to you.
Well, it's great to have you here because I've written a lot about the concierge medicine over the years, and it is interesting and people love it, but it can be expensive. Tell us a little bit about what One Medical Group is trying to do, because I know you're growing and you're starting to make some more noise out there that people are paying attention to.
Yeah, sure. We cringe a little bit by the label concierge. Concierge implies kind of two-tier medicine or medicine for the wealthy. Mm-hmm. That's not what our practice is about. It's really kind of taking a fresh look at the primary care model and making it much more affordable and accessible to everybody else. And what we've done is taken a clean slate approach at reinventing how primary care is delivered using information technology and really, frankly, designing the practice around the patient's needs, which is unfortunately not as common as we'd like to think.
And so how does it work, if you can walk me through it? Because I know it's actually in San Francisco, right? And I know you're looking at other markets. How would that work for a patient? Because I know in other models, anybody could probably go to a doctor and say, hey, doc, I don't want to stand in line for this, but I'll pay you a certain amount and you be available to me when you're available. Is it that simple, or can you walk us through how it works?
Sure. Yeah. The premise of the practice is, let's do what's in the best interest of the patient and kind of decouple ourselves from the odd economic incentives of the health insurance system. So, what we offer to patients is pretty clear and simple. Same-day appointments, kind of longer kind of visits and more time with your physician. Visits actually start on time, so it's a service culture and hospitality culture around the patient. And the online conveniences that you'd expect from a modern medical practice, so email communication with your doctor, online access and tools, you can book your appointment online and that type of thing. And what we've been able to do is offer this at an affordable price point. So members support our practice by paying less than a couple $100 a year, and the way we're able to do that is, frankly, just manage the practice better. The unfortunate nature of the way medicine is today in the U.S. is it's enormously complicated and complex, and doctors, unfortunately, have gotten less skilled at managing those complexities. And so what we've done is, on the physician's behalf, created a practice environment that better delivers the ideals of primary care.
And what do they get for that $200? Is it a situation where you have to first have a contract, your group has to have a contract with a health insurance company, and will pay your docs, or what would I get for that $200 if I wanted to buy your services?
The main premise is people are already kind of paying enough into the healthcare system through the insurance-based model. So we want to allow people to use their insurance. And so we accept most forms of insurance, HMO, PPO, or otherwise, and people can use their insurance through our practice model. We manage that. In addition, they can kind of support the practice with the annual fee, and that allows us to offer services that are not typically covered by insurance plans. Particularly notable would be, let's say an online consultation. So,
Gotcha.
And unfortunately the way the insurance system works today is the doctor only gets paid if you come physically into the office, but in reality that's inconvenient for a lot of people, and for some minor issues, people would rather have an online consultation and just deal with it virtually, rather have to schlep it in the office and that type of thing. So the fee helps us support that model where people can save some time and money by not having to come to the doctor's office. They save their copay, they save their deductible, all the other things that they would typically pay to come into the doctor's office, they actually recoup back ultimately in the long run.
And is it anything that the insurers care about? My guess is they wouldn't, considering most insurers are going to higher deductibles, and there's probably nothing that would prevent the patient, sort of like if they don't use a doctor in the network and they don't get paid for that, it would work like that, wouldn't it? It's just sort of like something else you would want to get.
Correct. I mean, we've designed the practice model to be beneficial to the system as well as to the patient. So obviously it's much more convenient and affordable for the patient. But for the system, having access to a primary care physician clearly lowers unnecessary ER visits and hospitalizations and otherwise. So, in the end, that's money saved by the insurance company and in general by the employee, because they're eventually paying for that healthcare down the road anyway. So there's kind of overall better use of the same resources. So our model not only is kind of higher touch for the patient, but we envision also being lower cost for the system in the long run, and the payers should benefit from that.
Well, if you're just joining us, or even if you're new to our channel, you're listening to ReachMD Radio, the channel for medical professionals. I'm Bruce Japsen, your host. And joining me today is Dr. Tom Lee, who's the founder of One Medical Group, which is a San Francisco-based company that's looking to set an example when it comes to primary care medical care. And we were just talking about a key part of their model where patients can pay $200 a year and get online consultations and so forth. Now, what else does that include? And also, is it something that these patients are already in these physicians' practices, or is it something that works just as well if I have my own doctor, but yet One Medical Group comes to my town and I want to pay extra for it? Do you recommend the doctors be a part of the practice, or?
Yeah, so, there's a couple issues there. The fee is very affordable, not just because, we've decided to make it affordable. The way we make it work is we manage the practice more effectively and efficiently. So this is not something that just any Joe Blow doctor can just kind of say, I'm going to charge a fee and suddenly it'll work. It doesn't work that way. You have to offer a higher level service. What's traditionally happening is people are charging $5,000 and working outside of the insurance system, or charging a monthly fee of, $60, $100 a month. And that works if you're working outside the insurance system and you can afford it. But for most people, that's kind of not worth it, right? It's just not worth the kind of additional expense on top of what people are paying for.
Right.
So to manage that practice system is more complicated than people realize, and that's why we do it on behalf of the physicians in general.
Well, give me an example of the higher level service. Can I make a phone call to the physician after hours? What are some of the things I could do if I were a patient?
Sure. So a lot of the things that people typically think about in terms of high touch are certainly within our practice model. So, same-day appointments, that type of thing. More time with your physician, that's certainly accessible. After-hours access to your physician's, mobile phone if need be for urgent issues and otherwise. Another kind of relatively simple application in concept but hard to execute is, simple prescription renewals through your phone, for instance. Or if you've got a very simple issue that doesn't even need to come into the office, let's say you're a woman who's got a urinary tract infection, more often than not, there are very clear protocols as to how to manage that, where you don't need to physically talk to a clinician. You can give us your information through the mobile phone, and we can handle that in a virtualized environment. That prescription can be ready for the pharmacy for you, and you don't have to physically come into the visit, and you may not even need to talk to somebody depending on what your responses are. So those are the types of things that we like to kind of push and innovate for the patient, and that's all inclusive in kind of our service model.
Now, do they have sort of a web portal set up at home? Do I have a website that I go to? It seems like this is where things should be headed anyway with the onset of electronic medical records, and I'm also wondering how would your model fit into that? It seems like it would fit right into that.
Yeah, absolutely. And so what we have is a dedicated kind of website designed specifically for the patient. So they can certainly register online, they can book their appointments online, they can manage their health history online, they can request prescription renewals online or on the phone. So there's a variety of options. Increasingly, there will be, much more robust data that they can manage as we continue to grow the model. But in general, what we want to do is give patients, the information that they want in a much more kind of transparent and accessible fashion, and it enables them to be, hopefully healthier and happier in their lives. And, we're just pairing that right now with a new educational site on our blog that gives people much more practical tips about content, healthy recipes, better lifestyle habits, those type of things as well. So, the model is really geared to give patients the information they need to be healthier and more focused on their preventative health. But when they're sick, we're certainly readily able to see them in the office for issues that require physical attention as well.
Now, why would it be good for a physician to join this? I know that in San Francisco, for example, you've got about 30 or so physicians. How many patients are into this, and what are your growth targets?
Correct. So, we've got tens of thousands of patients in San Francisco who are active, and, this model is growing pretty rapidly in San Francisco as it is. We've recently opened in New York, and we're opening in other markets throughout the country as we grow. So, in the near future, we're hoping to open in several new markets as we are expanding. The concept of kind of the physician-based practice is we want to kind of provide the practice environment for physicians and allow them to do this. And so that's kind of the infrastructure we're setting up, absolutely.
This seems to be a good marketing tool, if you will, for them. I mean, do they...
Oh, yeah, sure.
Mm-hmm.
Yeah.
Tell me a little bit about that.
The unfortunate nature about primary care is the way it's structured, the way the overhead of most traditional doctors are, it's an unsustainable environment. It's just unfortunately too complex and getting more complex. And so what that's resulting in is burnout from a lot of primary care physicians and, frankly, younger physicians choosing not to join primary care. Mm-hmm. And what we offer is an opportunity for physicians to practice what they originally envisioned primary care to be, which is spending time with patients, really truly managing their care and kind of building long-term relationships with these patients. And so, what's nice about our model is we give primary care physicians a different alternative to practice in where they can kind of, spend more time with patients and deliver what's always been envisioned but difficult to do in most practice environments today.
And what are the hours of something like this? I mean, do you have some physicians that are just doing these consultations by email and so forth, or are they doing a little bit of both?
Yeah. The intent is to kind of foster primary care relationships. So the physicians are both seeing patients in the office as well as communicating virtually through an online or email kind of format. And we think that's the best kind of form of transaction. Just like, you'll periodically have friends who you'll see physically and also kind of communicate via email or phone. It's the same kind of concept. So it extends the relationship outside the office environment. And these are full-time physicians. They're dedicated to managing your care, just like, most physicians are today, but with a better practice environment and better support.
What's the demographic of the patients? It would seem to me that you might even be getting some folks that don't have coverage with this. I mean, people who are just like, or maybe you're getting people who don't normally go to the doctor. I don't know. What are you seeing out there?
Yeah, it's a full spectrum, frankly. Currently, we see everybody from adolescents to seniors, people who have minor ailments to complex medical conditions to chronic ailments. So we're fully capable of seeing a broad spectrum of populations. We also see, insured and uninsured. Increasingly, unfortunately, there are a greater number of uninsured folks, and for those folks, we offer simple pricing that's clean, very affordable, and if people want to, pay just kind of directly, they can certainly do that and save money if they don't have insurance or otherwise. Our system is to give people a reasonable, fair price, not gouge the system like, some people have done.
Well, it seems that one medical group would also offer I have a young child, and I know sort of the yuppie parents of my wife, and it's like there's a peace of mind aspect to this where, they're getting charged $25 for after-hours phone calls, but if they could email a doctor for $200 a year, for something that might not be so serious, I mean, that would seem to play into this very well.
Yeah, that's absolutely the case. I mean, we want to give people an affordable price point, and the value there is significant. And a lot of that is kind of this peace of mind. I know that the person on the other line knows me. I know the system of care is reliable. I know that they have my personal health data, and they can kind of manage the full kind of relationship. And I can choose which format is most convenient at the time of need. If I've got an urgent issue, I can talk to somebody on the phone. If it's less urgent, I can just email them. If I'm traveling, I can send a note. So there's a variety of forms, and the goal, again, is to kind of design the needs around the patient and give them that accessible, trusted relationship with a primary care system that, truly cares.
And how do you see this playing out across the country? Any markets you consider where you want to go? You want to be everywhere?
The nature of our healthcare system is it's universally broken, and so we're getting universal demand. And because of that, we're getting universal demand from all parts of the country. So what we're trying to do is be pragmatic. We don't want to blow it open and kind of lose the service level for our current patients. So we want to grow at a reasonable pace, but we're in discussions with a variety of partners to help accelerate that pace in different markets. And our goal is obviously, our patients love this service. Over, 80% of our patients are coming through word of mouth. So we know that other patients around the country would love this service, and, it's just a matter of time before we can hopefully be there.
Do you have a website that physicians or other listeners could check out if they wanted to know more information?
Yeah, so certainly our main website is One Medical. That's onemedical.com.
Okay.
And certainly there are kind of places where people can look for jobs and other things, and that's readily findable as well. So if people are looking for a position with us, particularly in San Francisco or New York or kind of in our future markets, they can kind of send us a note.
That sounds great. Well, with that, I'd like to thank Dr. Tom Lee, who's been our guest. He's the founder of One Medical Group, a San Francisco company that's looking to set a nationwide example when it comes to primary medical care, and you will be hearing more about this in markets across the country. I'd like to thank him today for joining us. You've been listening to ReachMD. I'm Bruce Japsen, your host. ReachMD, online, on demand, and on the air. Please check us out at reachmd.com, and I'd like to thank you today for listening.